Wow. So thank you for that very kind introduction. Very nice long bio, but I have a new shorter bio, and it comes courtesy of a politician who said this to me recently, and I've adopted it as my biography. He said, "Picard, you're a hard man to ignore, but it's well worth the effort." Ce soir, avec ce prix, vous m'avez haussé au summum de ma profession. Et je dois dire que la vue d'ici est un peu vertigineuse. C'est flatteur et un peu intimidant de faire partie d'un groupe de lauréats qui inclut Jeffrey Simpson, Alain Dubuc, Feu James Travers, Chantal Hébert et évidemment Hy Sullivan. Journalism is a team sport, not an individual event. So I'd be remiss if I didn't thank my editors at the Globe and Mail. I'm lucky. They give me a very long leash. Though I have to say it's equipped with a Thompson-esque financial choker chain. There's one person at the Globe that I have to single out for particular praise, somebody I work with every day. That's Paul Taylor, our health editor. He's here tonight at my invitation. People don't realize this, but Paul is the invisible byline on all my stories. And he saves me from embarrassing myself a lot more than I already do, so I thank him for that. Les organisateurs de la soirée m'ont demandé de dire quelques mots sur mon sujet fétiche, que vous savez bien, est la santé. Mais ils m'ont demandé de parler pour 5 minutes maximum. So, in the 300 seconds that I have, I want to share with you my mantras for healthcare reform, and I hope they'll give you something to ignore or inspire you. Mantra, as you may know, is a Sanskrit word meaning instrument for thinking. Mantras are short phrases designed to focus the mind, and we can certainly use some focusing of the mind in healthcare. Mantra number 1, medicine is the easy part of healthcare. It's just plumbing with more expensive tools. We need to invest in things that will make people and the population healthy in the long term. Education, housing, the environment, meaningful work. And when people are sick, but when people do get sick or wounded or demented, we need to get our priorities straight for caring for them. We need to hold their hands and listen to them and comfort them. We need to help them navigate the care journey so they don't go through it alone. Then we have to worry about the plumbing, but we already do the plumbing well. Mantra number 2, the law is an ass. There's obviously a few lawyers in the room. There you go. Arrêtons de nous cacher derrière une constitution qui est un peu boiteuse. La santé n'est pas un pouvoir provincial ni fédéral. C'est un désir universel et un droit fondamental. Dans nos réformes, nous avons besoin d'être guidés par nos valeurs et non menottés par une rhétorique dépassée. Mantra number 3, and for this one I want to quote the legendary economist John Kenneth Galbraith, who said, "If you don't count it, it doesn't count." We need concrete health goals to be guided by evidence, to measure results, and to reward success. To do so, we need to invest in technology and in a culture of safety. And we need to make patient-centered care a mission, not merely a public relations catchphrase. Mantra number 4, you can't deliver 21st century healthcare with a 1950s system. You know, we gave the world Medicare, but that was the 1950s and 60s. Let's get over it and move on. Our health system was designed for the delivery of episodic acute care by physicians, principally in hospitals. That was great 50 years ago. But the reality today is that most patients have multiple chronic conditions, and they can be treated in the community and in their homes. We need to fundamentally reshape the system to reflect their needs. That means an emphasis on primary care, on team-based care delivery, and on creating a continuum of care, none of which we do very well now. Mantra number 5, and maybe this is the most important one of all: stop whining and start doing. The poet Shelley said this of his mother-in-law: "She has lost the power of communication, but sadly not the power of speech." Now, those words are a few hundred years old, but they describe pretty well my feelings about a lot of our elected officials and business titans and community leaders and journalists, and their seeming inability to articulate a vision for healthcare. The lobbing of rhetorical hand grenades like unsustainable and out-of-control spending is tiresome and counterproductive. Leadership is about finding solutions, and in this case, that means first and foremost defining what Medicare should be in the 21st century. What is it going to cover, and what is it not going to cover? That's the starting point. Have we lost sight of the raison d'être for Medicare? We brought in Medicare because it's just, it's fair, it's efficient, and it's cost-effective. We can have these social and economic advantages and be financially responsible. It's not either or. Leadership means not only articulating these values, but giving them life. Si vous êtes des leaders, arrêtez de pleurnicher. Agissez. C'est le temps. Si j'ai parlé trop longtemps, je m'en excuse. J'espère que mes propos ont au moins été stimulants ce soir. So in conclusion, I want to thank you again for this great honor, the High Solomon Award. But I also want to serve notice that I plan to be around a lot longer. And I plan to become increasingly cantankerous and obnoxious with age. And until our leaders embrace and implement real healthcare reform, until they stop the whining and start the doing. And I want to leave you with the words of Martin Luther King Jr., who said, our lives begin to end the day that we remain silent about things that matter. Healthcare matters, so we owe it to ourselves to get it right. Thank you, and enjoy.